I usually speak in English and mostly in English, but some people have requested that I speak a little bit of Urdu, but I don't know मैंने आपको मेरी अपनी secret बताई है metric में I had easy Urdu, not advanced. और easy Urdu में the passing grade was 33%. मुझे अल्हम्दुलिल्लाह 33 आ गए तो मतलब ये है कि my Urdu is very कमजोर. Thank God English was better, so I did all right. So I'll try. Any difficult words, I will make it Urdu, but there's some people who would understand English better. So the topic for today was bone and joint problems. So I have divided it into two. The first section will be talking about bones, and basically about bones, a little bit about the structure, what do they do, but more importantly, the main disease related with aging with bones is osteoporosis, which is essentially bones ka kamzor ho jana hai, weakness of the bones as we age. The second part, we'll talk about the joints, and again, very briefly, the joint structure, what is the structure? The diseases mainly we're concerned about disease of aging with the joints, which is osteoarthritis, and we'll talk about that and a little bit briefly about management. I don't think you can see anything. तो नजर ही नहीं आ रहा कुर्सी
हाँ हसन चल रहा है
जॉइंट अच्छे हैं डॉक्टर साहब
Why is bone health important? The problem is as we age, the bone density, they get less and less. And which means we have an increased risk of fractures, especially as we get older, the density gets lower, the bones get weaker, and we are prone to fracture easily. So that's why we have to be making sure that bones stay in good health. There are 206 bones in the human body, and they account for 15% of our वजन है, 15% of our weight is bones. And the bones are made of, about a third of them is organic material, collagen वगैरह कहते हैं. 1/3 is inorganic chemicals, and a third is water actually. So it's but equally divided. And bones is where we store 99% of the calcium that we need. The bone is like a tube. Inside there's a space which is called the bone marrow where we produce our red cells. Outside is the cortex, and the cortex is a compact outer layer and an inner layer, which is called the cancellous bone. But you don't need to remember the name, essentially remember the bone is a tube-like structure. And internally, it's like a honeycomb. What? That makes it strong, but light. So much so that weight for weight, a bone is as strong as steel. अगर एक weight का bone ले लें और उसी weight का steel ले लें, they are both equal strength. So it's very strong weight for weight, and that is because of the honeycomb structure that they have. And this is all calcium, like a stone there. Of course, the functions of bone, of course, is supporting and protecting our soft tissues in the brain. In the head, the skull protects the brain. In the chest, the rib cage protects the heart, and so on. And of course, bones are necessary to help us move. They are attached to muscles which help us to ambulate, to move. And they store minerals like calcium, and phosphorus, and the other major function of bones is, anybody?
Bone is रीढ़ की हड्डी है।
Andy?
रीढ़ की हड्डी है।
Rid ki haddi, that's true, but one of the major functions of bone is where we produce all our blood, in the bone marrow. Every day we produce 500 billion red cells, out of which about 300 are platelets. Those are the cells that stop bleeding. About 200 billion are red cells which carry the oxygen, and about 10 billion are white cells which protect us from infection. So bones are the place where we produce all our blood every day. We are producing a lot of it. We all have about 1 to 2 gallons of blood in our system. But let me ask you a question. The baby पेट में होता है, fetus होता है, फिर हड्डियां भी नहीं होती, there are no bones. So where is it producing blood?
Placenta.
From the mother.
Placenta.
Placenta, no. Placenta is only good for transferring nutrition
Umbilical.
and oxygen.
Not the umbilical cord either.
The blood is produced in the baby, in the fetus, in the skin. That is the first place that the baby develops the skin. It needs the oxygen, something to carry the oxygen, it needs red cell. So the first place they make is in the skin. Then the internal organs develop, like the liver and spleen. So the second place develops is in the liver. And finally, the bone marrow is there. So finally. And there are some diseases where the baby has a problem with the bone marrow. They cannot produce red cell. They go to the primitive way of producing red cell. So their livers are enlarged, they're producing that. And in extreme cases, you see bone marrow developing on their skin, and they develop over there. The placenta doesn't transfer any cells to the baby. It only transfers nutrition and oxygen. And this is what a bone marrow looks like with all the red cell production sites and white cell and platelets. The problem is there's a constant remodeling of the bone. That means as it's constantly being dissolved and new bone is being placed. And unfortunately, as we age, the formation of new bone decreases, whereas the old bones keeps getting dissolved. So that's why eventually it gets weaker and weaker. With this constant remodeling, actually the bones we have, every 10 years they're recycled. We have new bone in that place. If this is a constant cycle, the older bone being dissolved, new bone being laid down. So that means every 10 years in that part of the body, we have a new bone. But unfortunately, as we age efficiently, so you have osteoporosis or weakness of the bones. So the peak bone mass that with the highest density of the bones that we have is by 30 years of age. That's why we have peak bone mass, and after that, the bone loss is more than how fast we are replacing it, and the bone mass keeps going down and down. And this is a diagram showing that the peak bone mass is at 30 years of age. After that, it starts going down, and unfortunately, in females, for a number of reasons, it is significantly more bone loss, osteoporosis, than in men. And if you look at diagrammatically, this is how the posture essentially goes: is the peak growth, and then rapid loss, and then a slow loss. You have increased bone mass, stability, and then starts getting weakening, and we getting weakening, and we start getting a hunchback, and actually our height also decreases as we age. So bone loss is a natural part of aging, but unfortunately sometimes we get osteoporosis, which means there's an excessive bone loss. There's too much bone loss. It's not being replaced as efficiently, hence the bones get very fragile, very weak, and prone to fractures. So a healthy bone is something like this. You have this honeycomb structure, but it is strong. But on the other hand, when they get osteoporosis, the calcium and stuff is not being deposited as efficiently, so it becomes a weak structure and prone to breaking. What are the risk factors? I mentioned earlier, unfortunately, much higher incidence in females, and you look at different ages, by the time they hit 60s, the females in the pink, almost twice the risk versus males. And that risk continues to be almost double in the females versus male. And at about 80 years old, about 80% of women have osteoporosis versus about 40% of men. That's number one risk factor, being a female. Ethnicity depends on which ethnic background there is. And unfortunately, again, Asians, non-Hispanic Asians, we have the highest incidence of having osteoporosis for a number of reasons. We don't exercise as much, we don't go out in the sun as much, and our diet is lacking in calcium and vitamin D. Other risk factors, some factors that you cannot change. There's a genetic risk for everything. And unfortunately, there are some families where there's a higher incidence of osteoporosis. If there's a fracture history, not related to an injury, but very minor injury where you don't expect the bone to break, but it breaks easily, then you know it's not the fall, it's your bones were weak to begin with. Hormonal changes, as I mentioned, a significantly higher incidence in females because we need growth hormone and estrogen to support the growth of the bones. And females, when they get postmenopausal, they're not producing enough estrogen, therefore the bones get weaker and weaker, therefore you have much higher incidence of osteoporosis. And similarly, loss of testosterone in men as we age also decreases, causes of osteoporosis as we get older. There's some things that you can change to minimize the risk. Weight. Obesity is a major risk factor. Smoking. Nutritional deficiencies, obviously. You're lacking, not getting enough calcium or vitamin D. You increase the risk. Lack of exercise, particularly weight bearing, and I'll tell you why that is so important, how exercise benefits the bones. Certain medications, if you take for long term, particularly steroids, they cause bone loss. Other health conditions also lead to osteoporosis like diabetes and thyroid disorders and so forth. How does it present? Fragility fractures that happen without a good reason. Not a big accident, you just bump something and you think, oh, it's hurting too much, you get an x-ray, there's a fracture. So fractures that happen too easily with a minimal injury, those are called fragility fractures. And if you have those, that means there's some underlying osteoporosis, the bones are weak to begin with. Then as we age, and if there's a lot of osteoporosis, the spine is not straight, you get a hunchback, which is called kyphosis, and you also get shorter in height. Because of this hunchback, you start having neck pain. When you're doing like this, there's not enough lung volume, so you get short of breath easily, and your tummy bulges out. So that's the typical presentation. Hunchback, neck pain, belly bulging, loss of height, things like that. Then, of course, a tendency to fracture easily would happen. Simple test. It's not even an X-ray. It's not radiation involved. You lay down, and either the wrist or, in this case, they're checking the knee. They put the scanner on that, and it's called a DEXA scan, and that tells you the density of the bone, and there are certain numbers it shows, and if it's a high number, you know you got osteoporosis. By an X-ray, you can tell the bone looks kind of not that dense, but that should not be used because that's a subjective measurement. It might not look too dense to you, but to another physician it may look okay. So don't rely on X-ray. If you're concerned about osteoporosis, you need to get a DEXA scan. Who should get a DEXA scan? Any female above 65 years of age or above 50 if there are risk factors like family history, history of fractures, fragility fractures, and so on. In men, it's recommended everybody above 70 should get a DEXA scan to screen for osteoporosis. How do we manage osteoporosis? There's non-pharmacological, that means not related to using drugs. Then there's drug treatment and physical therapy. Non-pharmacological. Of course, you want to get nutrients, you have to have a diet which promotes bone health, so bone boosting nutrients. Exercise. All my presentation, whether it's dementia or fall prevention, I can't emphasize how important exercise is for your health, for your brain, for your heart, for your bones, for everything. Don't need to go to the gym, at least a walk around the house. If you can do around the block, that's better. If you can go to the gym, that would be the best. Avoid too much fluid and calcium with that, so that's not good. Bone boosting nutrients, of course, is calcium, essential to maintain the density of the bone. And good sources are dairy products, leafy green vegetables, fortified plant-based milk like soy milk or almond milk. Those are good. And we'll talk about the dose, but recommended is 1,200 milligrams per day of calcium. Vitamin D helps to uptake the calcium and deposit it into the bones. Sunlight is a good source, but in the weather over here, it's too cold, we might not get out enough sun. We may not get enough sun. So it is helpful, but at our age, it's better to take some vitamin D. And the best vitamin D to take is vitamin D3, polycalciferol, which is, you can get it in Costco, vitamin D3 capsules, and one every other day, unless you have a blood level which shows an excessively low vitamin D level, in which case you might need more. And of course, you need protein to support your bones, and lean meats and beans and nuts are good sources of protein. Recommended doses of vitamin D in females about 600 units, but above 50, about 800 to 1,000. But if you in males about the same, but about 70, you go up to 800,000 units. And this is for vitamin D. For calcium, 1,000 milligram, unless you get over 70, in which case 1,200 milligrams. And again, this is the maintenance dose. If you have a blood level which shows you have an unduly low vitamin D level, in that case, obviously, you need to boost your dose. So I hope once in a while, in your yearly, every other yearly checkup, they would be monitoring your vitamin D level, hopefully. If not, ask them. Good sources of calcium in the foods: yogurt, orange juice, which is fortified, salmon, sardines are good, cheese, milk, of course, tofu, kale, almonds. Those are really good sources of calcium.
Gary.
In addition to getting enough good nutrition, you need to have, occasionally you need to have drug treatment. And number one reason is to reduce the risk of fractures. And if you're having so much osteoporosis that you're having fractures, then certain drugs can be given to strengthen the bone. And those can be, biphosphonates, hormone replacement, and stuff to strengthen the bone. And second goal of drug treatment is if you have too much pain related to your osteoporosis, in which case you need painkillers, of course. And physiotherapy has a lot of benefits. It helps with the posture instead of getting this and this and this, which compromises your lung capacity, makes your breathing harder. Physical therapy will help. It will help improve your walking, going upstairs and so on. They educate you about management and doing about things when your bones are weaker so that you don't break them too easily, and overall general health and well-being. How does exercise help? Bones adapt to the stress that is. If you keep laying down the bones and you don't move, they're just gonna rot away. The muscles pulling on the bone causes tension, which causes there's a kind of cells which are called osteoblasts. And these are the ones that produce new bone. So with the stress on the bone, that stimulates these cells to grow and put on new bone. So exercise strengthens the bone by stimulating the production of these kinds of cells. So exercise is critical, particularly weight-bearing exercise, not aerobic exercise, but weight-bearing exercise where you stress the bones. Of course, with improved muscle strength, you get better balance, and better balance means there's a lesser risk fractures, which you are prone to if you're getting osteoporosis. In addition, exercising causes the release of hormones, which are good for the bone growth. Like I mentioned, we need growth hormone, testosterone, other hormones to stimulate, make sure the bones remain strong. So exercise also helps release those. And exercises increases the uptake. You absorb calcium better. You have better circulation, which means it takes the calcium to the bones where it is needed to be deposited to make the bones stronger. And it does reduce inflammation. I mentioned inflammation is a chronic process that we all get with aging. It damages the synapses in the brain that leads to dementia. It damages the bone production, and with chronic inflammation, there's more osteoporosis. So regular exercise diminishes the inflammation, therefore the bones stay healthier longer. Recommendation for exercise, maybe every other day, walking, and if you can jog, that's good. Stimulates bone production. Strength training, resistance training, like using weights and stuff, that helps. And you may be doing 2 to 3 times a week in the gym. You can do it at home. There are many exercises. And once a week, at least, stand on one leg, see if you can develop your balance better. Other things that might help with the balance and flexibility, doing yoga and stuff, and non-weight bearing exercises like swimming and stuff are good for heart health, but you need some weight bearing stuff. They're not as good for the bone. So the bottom line is, for osteoporosis, you need strong bones for maintaining your mobility
and minimizing the risk of fractures. And to do that, proper nutrition, which means getting enough calcium, vitamin D is important.